I'm Dr. Miriam Smith, your Nurses Show. I'm excited right now to share with you some statistics that I read from an article about the shortage of nurses. As you must have known by now, I have been a nurse for many years. I retired recently, and I just can't sit. I have to keep sharing some of my experiences, even through podcasting and live. At this time, I'll just talking a little on the shortage. We know shortage for nurses has been a long-standing topic. But as I read, different people were asking different questions in the article about the shortage. Well, I'm out of it directly for the past 3 years, but I know for sure, and I talk with my different nurses, my colleagues, retired, and those who are actually working still. It's really challenging at times because we have many young nurses are covering areas that would have been covered by seasoned nurses before, as they precepted. So they're covering uh, some complexities that normally they wouldn't have been doing. So right now, patients are living longer, and some of the cases are more complex for the new nurse. However, some of the questions were asked, how can we help? How some of the retired people could help. I'm saying from my perspective that there are programs in place, for example, residency program. Some places might have it for 5 months, some might have it for 6 months. I mean, others might have it for a year or so. But what I've noticed is that the residency program, when evaluated, it has helped immensely. I've participated in that program before, and recently I was on a panel and many discussion and pointers came out. It's valuable. The nurses shared their experiences. They would have gone to the area and they have worked and precepted, or they are registered nurses. But there are times they would regroup within the program, the structure of it. They would regroup, and the preceptor or educators and other maybe managers, yes, would be there to hear some of the concerns that they have, and those would be discussed at intervals, and they would see where they were and the gaps that were there, the gaps that's been there and that they've experienced, and they could get help. Uh, I've noticed also that there's a hospital that reported that in their program, before the nurse actually graduates, they would have in the final year they would actually have them going on the unit and actually work for like 5 months, and their transition into the nursing after they have graduated, they go through more seamlessly and they benefit a lot from it. So I think as nurses, junior nurses, senior nurses, we just have to all collaborate. Just have to, thank you from India. Thank you, thank you, thank you. They collaborate. Thank for your rating. I appreciate that. They would collaborate, put their thoughts together, and let it happen. And we have to work together. Managers, institutions, the interprofessional team, to let our new nurses feel welcome. They need to have that sense of belonging and that someone is there to help them along the initial phase of their journey. Very, very important, because this new phase can be intimidating. It can be very intimidating for them. And so then, as they get the exposure and to gain the confidence, they need others who are there to help them along the way. Nursing is a very rewarding profession, but it can yet be very challenging. And many nurses will tell you that some money, you that offer a lot of money. But the nurse has to have that compassion and be passionate about why they really want to help people. A sense of service, you know. It's not just the money, but wanting to help mankind. So that's very important, especially these times. And what we have to bear in mind, many of our young nurses are going to specialty areas um, than before. In my early years, nurses would have to have some med surg experience before they actually be transferred to a specialty area. Now, nurses are coming in and depend on the area that they're inclined to be or they like or they would prefer to be in. They have gotten the opportunity to do so. And so there can be challenges there too. It's from my perspective, it's good to have some med surg experience before specializing. Everyone might not agree with me. I've seen also new nurses come in and have in specialty area and have blossomed, have done very well, you know. But that's not as frequent. To me, that is infrequent. But the reality is there are many vacancies in specialty areas, and baby boomers like myself are retiring, and many are have come out since COVID. That's a reality. So whatever means that the institution can implement to help to retain for high retention, uh, it's important to do that, implement that. I remember hearing, well, I actually saw it where the nurses who were placed in the unit to work prior to their graduation, bearing in mind that there's the strong inclination for them to be hired by the institution that's training them or giving them that experience. They have a plan more or less to employ them when they are finished. And so we know that they need that special encouragement, they need that special embrace, and effort have to be placed from all different angles to help to retain our nurses. Many nurses have left the profession, have started and they have left because the workload can be overwhelming. And sometimes they feel burnt out, you know. And so I would just say, yes, I only believe in God, He'll do your family only. Well, I'm just saying that God has given man knowledge, and we have gone to school to learn, and so that we can help others too. Of course, we believe and we know that God ultimately is the healer, but knowledge shall increase, and He gives man the knowledge and to study, to research, and so many researches are in place right now, even for breast cancer, as we as we uh, as we embrace and as we celebrate the awareness of breast cancer this month. We're almost at the end of it. Let me hasten to say that my church, the women's ministry from my church, Sunday morning will be going on a march, and that's in support of Breast Cancer Awareness Month. Yearly we do that. We have those who have survived, we have survivors, and we still don't forget those who were with us and no longer with us because of this terrible disease. And so we have to give a shout out to those researchers who are tirelessly working to find the cure. I don't have long today, but I want to give a shout out to India because I've seen many of my Indian friends, my Indian those who are supporting and watching my program. Thank you also for the support, and my